Okay. So thank you very much, everyone, for being here or wherever you are, but here virtually. It is a pleasure to have you all for our second webinar of our working group that belongs to the International Society for Telemedicine e-Health. The group is called Digital Health for Space and Extreme Environments. And our speaker today is a member and a co-founder of this group, Professor Juliana Herbert. She's going to talk about empowering health professionals through digital knowledge. Professor Juliana Herbert is a professor at the Biomedical Informatics area of the Federal University of Health Science of Porto Alegre, Brazil. She's an associate researcher of the Universidad de la República in Uruguay. She is the director of the Space and Extreme Environment Research Center at the same university, the director of Digital Healthcare and Sustainability Center of the same university. She's a founding member of this group, as I mentioned. She's a team member of the Science and Technology Hub of InnovaSpace UK, and she's a member of the Space for Women Network, Office for Outer Space Affairs, UNOOSA, United Nations. So Juliana is going to talk for about 40 minutes roughly, and then we will open for questions and answers from the public. So this session will be recorded, as you know, and Juliana, the floor or the screen is yours. Thank you very much for accepting the invitation.
Thank you, Thais. Thanks so much for the invitation. I'm very happy to be here and talking to you about this area that actually is something that I'm really excited about. That's the idea of talking about the digital knowledge for health professionals. So the idea is that we're working with interdisciplinary projects, and it's very important that we think and we promote the kind of knowledge that we'll be talking about right now. So I'm going to share the screen, and oh, Thais, I'm not allowed to share the screen.
Again?
Yeah. I think that you have to allow me again.
Okay, here you are.
Okay, yes, now I can do that. Okay, I'm going to share it. And okay, so as Thais presented me, so I'm going to talk something about me very fast. And I have a bachelor's and a master's degree and a PhD in computer science. And I'm working now, especially with digital health, software engineering, digital inclusion, sustainability. And I really, oh, I think that I have some sound here.
It's really
Trying to mute.
Okay, I think that, okay, let me just, okay. So, and I really believe that science, evidence-based knowledge, and equity promotion and person-centered approach are very, very important to everything that we do. And as Thais has mentioned, I'm working with Biomedical Informatics at the Federal University of Health Science of Porto Alegre, and I have I'm working in these other groups. And we have here the Digital Health and Sustainability Center that we don't have a logo yet, but this is a center that we are just developing right now. And this is the context where I'm going to talk about, yeah. The Federal University of Health Science of Porto Alegre is located in the city of Porto Alegre, that's in the south of Brazil. Here we have the map of Brazil, and we are just located here. We have some pictures here of the campus. And this is, oh, sorry, this is a very pleasant and very nice campus. And of course, everybody is invited to know it when you have the chance to do that. But let's talk a little bit about digital health. So let's start with it. I'm just going to, okay. I'm just going to change here where you appear because you were, okay. Just, okay. So talking about the concept of digital health, yeah. I'm going to talk about the concept that is presented by the World Health Organization. That's a broad umbrella term encompassing e-health, as well as developing areas such as the use of the advanced computer science, like the fields of big data, genomics, and artificial intelligence, and lots of other fields. And I'm not going to talk to you about the importance of digital health or how digital health has been used nowadays. Of course, everybody is aware of that, but I'm going to talk about the importance of knowing or having some technical knowledge to really be able to use digital health in a better way, yeah. So if we take a look in the World Health Organization website, we have lots of publications about digital health. We have a working group that's working with digital health. And something that really calls or can call our attention is that we have some specific publications that are more aimed to health professionals. I also have some other publications that are aimed for software engineers, for example. But we can see that there are lots also of aspects, for example, related to interoperability of the systems, to usability of the systems, to some technical tools to be used. But the idea of working with this idea of digital literacy for health professionals is something that is mentioned, but maybe not so explored as it should be. There is a work that's very important that's called the Global Strategy on Digital Health that was launched, it was published actually in 2020 for the World Health Organizations that present some guidelines that we should be using to work with digital health in a more equitable way, yeah. And talking about this idea of using digital health in the sustainable development or the sustainable development concepts, the context, yeah, we have the Agenda 2030 that where 17 sustainable development goals were proposed. And if we think about digital health, actually something that can be used related to all these sustainable development goals, yeah. For example, we can relate digital health directly with the Sustainable Development Goal 3, that's good health and well-being. But actually, we can think about digital health as something that can be used to promote gender equality, for example, or can be used to reduce inequalities. So, of course, it depends of the way the digital health is being developed and is being used, and the way digital health is being understood by the people that are using all this tool, all these resources, yeah. So this is something that, of course, we can really relate these ideas of digital health when we understand the sustainability concepts and we understand the concepts related to this technical part, let's say, of digital health. So there was a paper that was published in February this year that relates directly the idea of the software and the United Nations Sustainable Development Goals. And in this paper, actually, there are 3 terms that were presented that are software sustainability, that's related with the idea of developing software in a sustainable way, so using less resources, for example, so considering how we can develop a software and being sustainable. And we have these two other concepts that are software as part of the sustainability. That is the idea that software is one of the requirements of the sustainability, and the other is the idea of sustainability being achieved using the software. So actually, during this lecture, we'll be going to talk about specifically or more about these two expressions. So software as part of the sustainability and sustainability by software. So thinking that actually the idea of using digital health has some ethical commitments, have some, we need to think about some in a broader way to work with digital health. Examining the global strategy on digital health published by World Health Organization, we have as the vision something that's very important, that's the idea of improving health for everyone, everywhere. And we are talking about adopting digital health in appropriate, accessible, affordable, scalable, and sustainable person-centric digital health solutions. So this is something that is really important when we consider this area of digital health. As I mentioned before, my background is in computer science. So my undergraduate course, my master degree and my PhD were in computer science. And something that's really interesting is when we just are doing some research in computer science, we talk to people that are in the computer science field, and we have some specific view about that. When you are working with interdisciplinary or multidisciplinary projects, you are working with different people with different perceptions of everything. And when we are talking about software engineering, specifically, that's my main area of knowledge. In this context of digital health, we need to talk about some broader vision that that's not just related to software developers, software engineers, for example. So let's take a look in the guiding principles of the global strategy on digital health of this publication of the World Health Organization. Yeah. So one of the guiding principles that's very important in the context of this lecture is that we recognize that successful digital health initiatives require an integrated strategy. So what's in an integrated strategy? So what kind of integration we are talking about here? Yeah. So the idea is that we need to have a robust strategy that integrates, of course, all these aspects and all these resources. And we need to work with this idea of the literacy in information and communication technologies. Yeah, as I said before, and as I just mentioned before, I'm not going to talk to you about how digital health is important nowadays, but of course, everybody knows about that. But the idea is that this idea of digital health literacy. So the literacy related to this area is something that really think needs to talk about. Yeah. There is this other paper that presents the idea of digital inclusion as a social determinant of health. If we think that about this digital inclusion, yeah, sometimes you can think that, of course, lots of people nowadays use the smartphones, use the computers. So internet is something that's more accessible nowadays. And but we think about digital inclusion, we are not just thinking about the access to the technology. We need to think about the idea of people really understanding how to use the software, really understanding what the kind of things are to use the functionalities of the software. And we needed to talk about all kinds of literacy, all kind of digital health literacies. So I think that some of you already know Dilbert by Scott Adams. So we have some things that are related to Dilbert that just present this idea of two different groups, like software developers and user or customers. And something that it seems that there is some disagreements between these two groups. And the idea is that all this idea of requirements, for example, is something that we just say that the user doesn't know what he wants, and the users and the customers say sometimes that the software developers don't understand the domain. But the idea is that, for example, in our biomedical informatics course and biomedical informatics projects, we work with trying to understand the health domain. As I said before, the idea of this lecture is that we'll be talking about this broader concept of digital health literacy. When you see this idea of digital health literacy, we can consider, for example, the personal health literacy and the organizational health literacy. The personal health literacy is related to the way that people can understand the digital health. And of course, we have different kinds, different groups of people, like users, for example, and some kind of, for example, developers, and we have these organizational groups. And when we think about users, we are thinking, we have lots of studies that are related to promote, for example, usability features, non-functional requirements. So the idea is that we work with the idea of usability heuristics, for example. So the idea is that software has to be easy to use, yeah. And when you think about software engineers, for example, we talk about requirements engineering techniques, about agile developments, about other approaches. When we think about the organizational health literacy, we think about the promotion, the digital health equity promotion, the digital reaction to the pandemic, the exchange information about all the sectors. But when we talk about the customers and the interaction of the customers with this idea of the developers, for example, sometimes we don't talk about the kind of technological knowledge that the customers should have to be integrated in a better way, this kind of software development projects. Yeah. So we're going to talk about some concepts related to software engineering. Software engineering is something that is much bigger than software programming, software development. We talk about software engineering with the idea of using engineering techniques and combine it with software development practices, and specifically having something that can be more repeatable and consistent from project to project. So we have some techniques, we have some phases, and we talk about software projects. We have this chaos report. That's the last chaos report that was published in 2021, last year. And we can see that software projects now worldwide, we have this rate of 31% of successful projects just. And we have 19% of projects that are failed and 50% that are challenged. So, I mean, here we had some problems, some important problems happening with this part of the projects. And there are lots of studies trying to understand and trying to identify the kind of problems that are related to this failure, to this so high rates of failures that are related to these software projects, yeah. And what's really important to understand the software projects is that we have a software development cycle that's composed by phases. Here is one example of the phases, for example, and we start using, for example, the idea of the software is that, of course, we have the idea, we have the project in general, and we need to go phase by phase in order to have the software product at the end. And when I'm talking about this idea of the cycle, I'm talking that when we think about the health professionals, digital health specifically, we needed to think that the health professionals should be understanding what are the phases of the software development cycle. So how is the process of developing software? And of course, it's something that we software developers are much more used to know it, but something that we have to promote, we have to offer some chances for the health professionals to understand all these phases, and in such a way that you'll be able to have skills to integrate this kind of projects in a much better way. For example, when you're talking about the phase of planning, we're talking about the health professionals to be understanding the phases, to be understanding the idea that each project has to be a scope, and there are some implications when you change the scope in the middle of the project. Of course, you can change it, you can have some change of plans, but there is some implication about that. It's really important that the health professionals should be aware about the technical tasks that are planned for the project. So the idea is that understanding technical tasks or having some idea of the technical tests that will be conducted, they will be able to interact in a much better way with software developers. We need to plan risks, we need to plan resources and the work products, the schedule, and we need this idea of the stakeholders collaboration. So when we talk about the idea of the understanding resources and understanding risks, is that, for example, we can plan some applications, some software products that require the use of internet all the time. So what are the implications of having this kind of thing? What kind of implications do you have if we are using colors, for example, in the software products? This is something that it seems that it's just a detail, but something that can be very important when we are talking about some software project that will really be going to be used. Yeah. When we are talking about analysis and design, we are talking about the idea of the health professionals understanding really what are requirements, what are the functional requirements, what are the non-functional requirements. So functional requirements are related to the functionality of the software, is more related to the scope of the software. Non-functional requirements are related, for example, with private issues, with performance issues, with some resources that are needed for us to use the software in the domain context where for which this software is being planned. Yeah, the ethical implications of using the software. So for example, in Europe, we have the GDPR, and here in Brazil, we have the LGPD. So there are some protection laws that were developed to work with the idea of the privacy issues, because this is something, of course, digital health is something that is related to sensitive data. For example, if you lose your credit card or something like that, you can just cancel in your account bank. You can just change the password, but you can't change all your health history, for example. Yeah. So the idea is that the health professionals should be aware of the privacy issues, the kind of database that we're going to use, how the data will be stored, what kind of data will be generated, and how this data will be stored and used after that. For example, there are lots of projects that that have failed because we didn't plan the way data is being collected and sometimes we collect data and they are not able to use this data in the way that you should be using, because there wasn't, you didn't have a very big plan, for example, and there are some problems of misunderstanding between these two groups, software developers and health professionals. So knowing something about these technical aspects of design and analysis are really important for this idea of the integrated approach. When we talk about implementation, we are talking about software coding, and it seems that sometimes it seems for people that are not in the software engineering field or the computer science field, that this idea of coding is something very difficult, or something that just these computer science people will be understanding. But actually, we have this idea of high-level coding, for example, that could be very important for health professionals to have some knowledge about logic and things like that. I'm not talking about the idea of health professionals coding some specific projects, for example, but having the knowledge to understand a little bit more about the work that is being done. And for example, there are some no-code tools that are being used nowadays that could be very important and very interesting for people from the health, like health professionals to know. And specifically here, I'm just mentioning some platforms, some machine learning platforms. For example, this Google Teachable Machine is completely free, and you can, without coding, you can understand much more about machine learning, use it with, for example, with sounds and with images and with some text recognition. So this is the kind of thing, this is the kind of knowledge that is important, specifically or mainly when we are talking about the idea of bias, for example. When you're talking about machine learning or artificial intelligence in a broader way, we can have this kind of bias. I mean, when we talk about machine learning, we were talking about the machine learning something, and the machine learning something based on or something that we are just providing to the machine. So it depends of the kind of material, the kind of resources that we are providing to the machine will be learning in some way. And of course, we can have lots of bias related to that. So we really don't need to understand how to code a neural network or something like that, but we really need to understand the basic concepts and how it works, and so it will be much easier for the health professionals to understand the kind of risks that are related to this kind of projects, for example. So, and when we are talking about testing, integration in the maintenance phase, we are talking about the idea of evolving the health professionals in testing activities. For example, in 2016, I've published a paper that is called Patterns to Teach Software Testing to Non-Developers. That's based on some experience that we had in our university, and just teaching the idea of software testing concepts. For example, when we test the software, we can't test everything. So we need to do something. We need to work with priorities. And one of the ideas, or one of the ways to use the priorities, is to use this risk-based approach for testing, for example. And this idea is that we will identify the kind of risks for each software, and then we'll be just developing software testing cases, software testing approaches to assure that the most important parts of the software will not fail and will be used. So I just presented some ideas of how what kind of knowledge should be important for the health professionals when we are talking about the digital health projects. And I'm going to mention some of digital health projects that we had in this context of the undergraduate course of Biomedical Informatics at UFCSPA, at our Federal University, in the context of the center, as Thais mentioned, and actually it's led by Thais and me, and the Space and Extreme Environment Research Center, and the context of Digital Health and Sustainability Center. One of the projects was this app that we had as customer. We had a physiotherapist, and I just forgot to mention that all these projects were developed in the context of a course that we have, that's a software engineering course, where the students, the biomedical informatics students, learn how to develop software, passing through all these phases that I've presented before, like the planning, analysis, design, coding, and so on. And the idea is that the students already know how to code, but they are working, they are learning how to produce software in a repeatable way, in a more disciplined way. So they learn about these techniques. And the idea is that we are using these techniques in real projects. So we have, as customers, we say that are customers, but we don't have any money involved in, of course, in these projects. And all the projects, the idea is that they are going to be used in the public health systems here in Brazil, or for teaching purpose or something like that, in a free way to use that. And the customer is involved in all the software development cycle. So it's something that, of course, the students learn a little bit more about the domain where the customer works. And the customer understand, or this health professional, the customer is always a health professional, they learn more about the software development phases that are part of the software development cycle. So it's something that we are just improving. This actually, we just had 5 editions of this course, and we are improving the way that the health professionals are integrated in this kind of software projects that are developing. So mentioning some of them, yeah, we had about 25 projects already developed in this context, but I'm going just to mention some of them. The first I'm going to mention is this application, this app, this mobile app that was developed. We had as a customer a physiotherapist, and the idea is that something to assess the balance, this idea of the computerized exam dynamic posturography. So the idea is that instead of using this expensive platform to assess the balance of the patient, we are going to use a mobile, like a smartphone, that's just attached to the body of the patient. And then it's going to generate some graphics that are going to be used by the physiotherapists to understand and to analyze the balance of the people using, for example, like in these different positions with eyes open or closed and something like that. Yeah, and it's available actually for download for everybody who wants to download this kind of thing. This other experience, this other project that we had as a customer an ophthalmologist doctor, and actually had 2 different projects here. One of the projects were an app, a mobile app that was developed to be a kind of, as you say, a kind of Uber, but Uber in the context of this idea of using or capturing these retinal images using the smartphones. So we have here a picture of a student taking a retinal image. Instead of using a fundoscopy, that is a machine that's very expensive, the idea of it is that we are going to use their smartphones a smartphone, and this kind of artifact that was printed in a 3D printer. And with this artifact, we are just capturing these retinal images. And this app is used to call or to, for example, we have some doctor that needs this kind of exam. So just register the information here, and this information is just sent to people that were trained to do this kind of exam. So the person that's more close, or that are closer, or that has the availability to do the exam, goes there to the hospital and do the exam. So we capture this kind of images, and we had a second work that was to use this kind of images as a base to a neural network. That's a kind of machine learning approach that we have to identify diabetic retinopathy. Yeah. So this ophthalmologist doctor was involved in all the phases of the software development. So he understands lots of things about technology, and understanding all this kind of things that are related to technology. Of course, he is able to better use this kind of digital resource. For example, we had some problems with the flashlight to capture these images. So he understood what kind of implications have the flashlights for the images. Why we need this kind of images to use the machine learning approach, and things like that, that of course are not part of the medical doctor's knowledge in general. Yeah. This is another example that we have the customer, a rheumatologist doctor, where we just this kind of information that were used in paper, we just then translated them and implemented them in a web-based application where this information was registered and then could be used by the doctor to do some analysis and things like that. And of course, it was really important for this doctor to understand the kind of database that we're using, how we're be going to store this data, how we're going to use this data, what the implications of the risks of using this data in an electronic way. This is another example where we have this the control of the follow-up of the nursery services in an oncological context. This is a mobile app. We had a customer, a nurse. This is another example using virtual reality. So this software was developed. This is the VR workout for people with motor limitations. So we had a customer, a psychologist that works with rehabilitation. And the idea is that people would be using this virtual reality like glasses, and they were going to do some exercises, but we are talking about people with severe motor limitations. So the idea is that we are going to use some involuntary movements that are being produced by the muscles using virtual reality. So can you imagine what are the implications of using this kind of thing, for example? So it's really important to have some knowledge about how virtual reality is implemented, what kind of tools we're going to use, what kind of data is being generated, and things like that. Yeah, this is another example, like it was an escape room that was developed by to be using a biophysics teaching. We had a customer, a biologist, and the idea is that we have like this idea of escape rooms that we have physically, but we have a kind of game. So to teach some concepts, and we have some sceneries. So you see the kind of things that we need to think when we're talking about sustainability, or when we're talking about the real digital inclusion. So the kind of the characters that we're going to use, the kind of clothes that we're going to use, the kind of the context, what are the implications of everything, yeah? This is another one that was this was a mobile app and web e-learning that they were developed to had a customer, a medical doctor, and were developed to help the community in family planning actions. So the idea was something like for learning and to control and to understand and to do specifically the follow-up of all these actions of the community. So we have here several ethical implications too. So of course, family planning is related to lots of issues, and in all, these issues should be considered when develop software, should be considered by the software developers, should be considered by the health professionals, and we really can have this kind of integration when the software engineers understand the domain, understand all the domain where the software will be used, the context where the software will be used, the field, the domain, and when health professionals have some knowledge about the technical aspects and the risks that are related to this kind of software. Yeah, and this is another example where we had the customer and occupational therapists, and the idea is that there are some games that were developed to help children with multiple disabilities to work with the occupational therapy. It was developed during pandemic period where these children were having this kind of occupational therapy using internet, and we are working with organization with people that had some big problems with internet access and things like that. So it's something that, of course, was considered during the development of the software. We couldn't have a software that would be requiring, for example, the use of internet all the time and things like that. Yeah. So going to the end of the lecture, yeah, the idea is that when we talk about digital health knowledge, we are not just talking about how to use that, yeah. And when you say, okay, so the health professionals should be knowing more about digital health, so knowing there are lots of resources and things like that. Of course, this is really important, but I think that it's really important to talk about the ethical commitment related to this kind of projects. As I said, we have sensitive data, we have all the risks related to the digital illusion that we can have, having digital software and having resources, but if we are not thinking about all this idea of the goals related to sustainability, and we are not thinking about real interdisciplinary projects, we are not thinking about a way to develop skills, talents, and knowledge for everybody, actually. I'm thinking about the idea that the project should be used not just to develop software, to develop a digital health product, but also to develop skills, talents, and knowledge of everybody that's involved. Yeah, software engineers, health professionals, and of course, the users. Yeah, so that's it. Thank you so much for the opportunity of presenting all these ideas. And I'm going to stop sharing my screen, and I'm available for
Thank you very much. Excellent lecture, very, very interesting. I can relate to that because I was for a long time, many years, a professor in a master's degree of biomedical engineering. And of course, my students are engineers or people from technical area. But I always believe that they need to know, for example, how a heart works or a kidney works to be able to develop a machine to evaluate the heart, like electrocardiogram, or even a hemodialysis machine to replace, let's say, the kidneys in patients that need this type of treatment. So I think that this it's a two-way street for sure. The people from the technical area must understand a bit of medicine and physiology and related areas. And as the health professional must understand a bit of this, all the technical aspects of softwares and so on. So the work can be not just more sustainable, but it will be optimized, and it will be much better, will bring a much better result. That was my comment, but thank you very much, Juliana. Now we have time for questions and answers or other comments. If you want to share your experience somehow under this topic that Juliana presented, please don't hesitate. Don't be shy. Juliana is a very nice person. I know her for a long time now, and she will be very happy to answer your questions or discuss your comments. Anybody? So lots of congratulations here in the chats. Zania, Ariel. And we have, well, two Romanians at the same time. So ladies first, Raluca.
Thank you very much, Juliana, for this very comprehensive lecture. I couldn't imagine that there are so many implications and from so many directions. I have, in fact, two short questions. The first one, I didn't understand exactly what I should understand from a risk-based approach for testing. This notion wasn't very clear. Maybe I have an understanding, but I don't know if it is a correct one.
Okay, thank you so much, Luca, for your question. Yeah, actually, I just presented some ideas, and I really didn't explain it all of them. But the idea of the risk-based approach is that there is, for example, when we test some software, we are not able to test everything. One of the principles of software testing, and this is my PhD area, is that we are not able to test everything. So we have to choose, we need to have some strategy. And this idea of the risk-based approach is that this strategy is based on the risks. So for example, you define the risks that we have different categories, different risks categories, but the idea is that you will be focusing your testing efforts in the parts of the software that are more important. For example, if some functionality fails, it will be like a priority for the software, but it's something like the color change or something like that, maybe it's not so important. So the risk is lower than this functionality, for example. So to understand the risks, it's very important to have this integrated approach, because we have risks that are related to the domain, and you have the risks that are related to use of this digital health solution in this domain. Like we need to understand what kind of user is going to use the software, in what context the user will be using the software, what kind of problems, what kind of bugs, as we said, the software bugs, what kind of software bugs have the bigger implications related to the use of the software. So this idea of listing the kind of risks that you have, and evaluating the risk, the impact, and the probability of the risks this is something that we need these two kind of knowledges, yeah, the domain and the technical aspects. And of course, if we have people that have some knowledge about each of these two aspects, it's much easier. I don't know if I answer your question, Haluka.
Yes. So now there are other questions, but I think that we can discuss in private, not to spend everybody's time. But a second question, if you, for instance, if you would be asked now to plan a digital strategy for a given direction, how could you start?
Oh, it's a very complex question, a very good question as well. And yeah, it depends of the context where we have this strategy, yeah. But thinking about this specific context, for example, for a specific project, yeah, well, I think that I'm not thinking about the country strategy or the world strategy or something like that. I'm just talking about a strategy, a specific strategy to be used in a specific project, yeah. So it's very important to understand what are the phases of the project, how each person will be involved in each of the phases, what kind of knowledge is important that people will know in each phase. So what kind of risks will have related to the project? And so I'm talking a broader way here, yeah. So for example, in our context, and something that's related to a project, and Thais and I were starting right now, that we are just identifying some artifacts that could be used in a project that can be used to teach health professionals to understand a little bit more about these technical aspects. And then these health professionals will be able to define, for example, to help to define the requirements. So of course, they need to understand what are requirements, how requirements will be used, what kind of requirements we should be thinking. So the idea of coding, prototyping, how can we prototype? How a health professional can prototype some tool to present an idea in a better way for a software developer's team, for example, and how this team can understand a little bit more about this domain. Yeah, so I think that my answer is not so specific, but actually is related to something that is a broader project that we are just specifying, but it is to simplify and prioritize the kind of actions that you have. And when I use it to say, and I have some of my students here, and I'm very happy to see them here, and that when everything is important, nothing is important. So you need to prioritize some things. You need to simplify some approaches, and then we can start simple and then going after that in a more complex way. So I was not very specific, Raluca, but I hope that I gave you some light about your question.
I didn't want to be specific. Exactly, that's what I'm meaning. I want to see the entire thinking and then to try to apply it in my field. Thank you very much.
Thank you. Thank you so much for your questions.
So next is Silvio.
Thank you very much, Dr. Thais Russomano and Dr. Juliana Herbert. Very insightful presentation. Can you hear me all right?
Yes,
Perfect.
I can hear you, yeah.
Perfect. It's a bit windy here in London, but it's quite warm as well. So when we're talking about digital health, especially in extreme situations and extreme environments, there are many aspects we need to be aware of, not only the human body, but also the environmental aspects of it, like the situation or the environment where that human body is. And from that perspective, what do you think are the most needed features which are not covered yet by the existing digital health technology? Are there more about, I don't know, visualization or modeling or prediction? What kind of aspects do you think that ideally, if they were developed and deployed, they will do a lot of, they will provide a lot of value in those situations? Thank you.
Thank you, Silvio. So great to see you here. And that's a very interesting question as well, and a very complex question. And actually, you see, there are lots of areas where we can have some technological new features or something that, of course, we need to improve. But what I really think that is, this is a personal point of view, but is that we need to improve specifically this idea of the person-centric approach. and the use of things that are already proposed. Yeah, you see, I think it was like 7 years ago. I had the chance to participate in a course, a testing course for it was taught by a computer scientist professor. And that we are just using some testing techniques, software testing techniques that are proposed during the 70s. Yeah, some of them were proposed when I was born, like the year I was born. And actually, I'm not going to talk about this kind of thing now, but actually there are some of the techniques that were proposed lots of years ago, but are not being used completely and maybe not really understood in a complete way. So of course, it's very important that we have improvements in technological aspects, like as you said, data science, data visualization, for example, things like that. But it seems to me that there are lots of things that already been that are already used. We are already using, but maybe not understanding completely, and maybe not having this idea of the digital health literacy related to everybody that is involved in this kind of things. So there are some studies where we analyze, for example, the part or the percentage of the functionalities of the software that is used. And if we consider the percentage is very low, so just small parts of the software that is produced is being used. And sometimes because people don't know how to use the other parts of it, or don't understand the other parts of it. So in thinking about this kind of thing, it seems to me that we need to have this idea of this person-centric approach. And we need to understand the kind of commitments that we have. For example, yesterday night, I was with some of the students that are here, the software engineering classes, and they were just talking about the role or the responsibility that we have as biomedical informatics professionals to promote, to explain how all these things happen and how all the development happens and all these technological aspects are using all these technological aspects. Yeah. So yeah, I think that my answer was a little bit long, but my idea is that technological aspects should be improved, but we really need maybe to have to focus our attention about using the technological aspects and technological resources that we already have, and maybe to better use that. I don't know. What do you think, Silvio, about that?
Yeah, I completely agree with that. I think especially in domains that require a lot of expertise, the interfacing and the way the tool is provided should be very intuitive, especially if it's something that has to do with health or extreme situations or let's say key operations. They need to be able to understand quickly and act quickly. I remember there was a master class from one of the Canadian astronauts from Chris Hadfield, and he was saying that they always have a one-pager about complex technology or complex tools. So in case something happens on the International Space Station, they can act in the time span of one breath. Consulting this. So yeah, I completely agree with that. Thank you.
Thank you very much. Now we have Lynn from Brazil, no, sorry, from France.
I want to go to Brazil, no problem.
From France, from Paris, Paris.
Paris. So thank you very much for this very interesting lecture, really. Thank you very much. I think what I feel is missing in your presentation, you promote health literacy for health professionals, but my experience in developing countries is that usually you have successful pilot, and afterwards scaling up is extremely difficult because the politician and the one at Minister of Health, they are not health professionals, they are just politicians. They have no idea about why is this pilot more interesting than another. I think maybe it is some job for International Society of Telemedicine and e-health to organize some webinar for politicians.
Yeah, that's true. Yeah, admin and administrators and
Yes,
politicians, they sometimes they block good ideas, or they don't allow them to expand, you know. And as Juliana was saying, it is very important that digital health helps the sustainability of the projects,
absolutely.
global health. And of course, without the inputs or the support from the politicians and administrators, we are stuck, you know, because we cannot do much.
But if they are more aware of and more involved in discussion at the stage of strategy and not after the pilot and just asking for money for scaling up and maintenance, but they are more involved, and if they understand better what are the obstacles, what are the benefits, I think we might. Sorry, I'm just going to. This is just a suggestion.
No, thank you very much, Lini. Well, Lini has just joined our working group at the International Society for Telemedicine and e-Health. So she's now part of our working group. Raluca is also part of our working group, as Marlise. So we have lots of representatives here. Even that Ganapati is missing, he's not here today. But I'd like to ask Neja, is that correct, how I pronounced your name?
Neya. The J is a little bit tricky. So hi, thank you, Juliana, so much for this insightful presentation. Made me think about, you know, a lot of steps that should be done in Slovenia or Europe. But anyway, so I'm from the Standards and Accreditation for Telemedicine and Telehealth Working Group. So, but I'm so happy that I joined this lecture and made me think. I have another question, but then made me think about this politician point of view, and just to say that we were trying now for 2 years very hard to involve politicians or decision makers, to be correct, into the these processes of, you know, making them aware how some of these projects that are national or international are important, how they should support it. But that's a whole story about this. But anyway, I was intrigued by the fact that you have actually a whole year course about for developers how to develop software that is, if I understood well, the person-centric, through this person-centric approach, or how the end users are accepting the software. So you have like a course on that, if I understood correctly.
Yeah, I'm thanks so much for your question, for your consideration. And I'm not sure if you were asking about the course where the software projects were developed, or this other course, or this idea of teaching health professionals to some technical aspects. Yeah, because we have this, sorry.
Yeah, go ahead, yes.
Okay, so we have this software engineering course that's in the context of biomedical informatics undergraduate course. So we have 2 semesters, software engineering 1 and software engineering 2. And during these semesters, so the students learn about these techniques and they apply these techniques. So it's very interesting because, for example, when I study software engineering in the last century, and we are just using some hypothetical projects. And now we are using some real projects. And of course, it's the motivation for the students is much bigger then. And the idea is that these health professionals will be understanding a little bit more about the software development cycle as well. Yeah? Because they say, for example, we sometimes we think that, okay, we develop software, we just say, okay, what we need, and then some people will be just developing the software and everything happens. And of course, there are lots of phases. There's something that we know how to, I don't know, maybe we don't have all the knowledge about building a house or building, I don't know, some tool or some like a toy or something like that. But we have some idea that we can't build a house in 2 days or 3 days or something like that if we are not using like these pre-built components or something like that. But with software, it seems a little bit abstract. So the idea is that we are just showing that there are some steps, there are some phases. We need to have some intermediate work products, and then we can have the software developed there. Yeah, and you are just actually defining something that is more specific for the health professionals. So it's something that is just being planned, a specific course for this kind of public. Yeah. I don't know if I answered your question.
Yes, yes, thank you so much. I think your students are very should be very happy that they have the possibility to do this in a in a applicative way. So this is great to hear that you're offering that.
Very hands-on is very important, to get to develop the skills and understanding of the theory behind it. So Frank Lievens, president of the International Society for Telemedicine and Health, welcome from Belgium.
Hey, Thais, and everybody that I know, I don't know. And actually, I'm not the president, I'm just the secretary of the International Society. Great webinar, wonderful. And it's in a series of, well, we expect from the International Society to run about 25, 30 webinars a year. They're all very instructive. I'd like just to react on 2 points that were just brought up. First, the political aspect. Well, digital health, telemedicine, e-health, whatever you call it, is politically loaded and has always been and will always be, meaning that if it needs to be integrated in the society, in the active medical world, it will require political decisions. And they may vary from country to country, from region to region, from continent to continent. And yet it is not only international, it is universal. You know that when we see the applications of telemedicine, digital health with the space program, that's no longer international, that's universal. And yeah, but politicians, they only join when they're sure that it's a win-win situation. They always come the latest way. How to convince them? Well, just let time do its work. We have just seen it with the Corona situation. All of a sudden, the application that we have been sort of advocating for 20 and more years was automatically accepted. From a distance consultations, because there was no other choice. And of course, the politicians and certain of countries, some of them which were actually most reluctant to it. If I say, well, India was one of them. All of a sudden, it was approved, by the parliaments and everything. So I'm very confident that, again, let time do its work and they will join because they will be put in front of the evidence that, and even more so, that there is no other way. And then they will approve it. So that's the soft way to do. The only thing, yes, it takes the time. But my friends, I'm sorry, time is the only thing you cannot buy or sell. And if we think that telemedicine and all these programs exist more than a century, when in the past, even before the telephone, the telegraph was used between some doctors to exchange some information on specific patients, and especially in war situations. And God knows if at this time, with what's happening here in the east of Europe, also it plays an immense role. That's a political thing. And I'm confident organizing, oh yeah, I'd love to organize a webinar and seeing, 10 speakers from political boards. I'm afraid they won't take time to do that, and they won't be easy. And some of them may want to be paid for that. So we don't follow that at the point. Hopefully they will listen, and they will listen to the reality of what you people in the field are defending. The other point, that's education. And this is something that where the international society right now has been putting major efforts into. We have created a special program managed by Professor Jefferson Fernandez on education. And that involves so many things. Education is the future. I myself am from the old generation, so I won't be there in 30 years from now. But it's a future, and that's the good news as well. The youngsters, those that are today in medical schools or in engineering computer schools, you know what? We used to work with a pen and write down. These young guys can't even do that anymore. That's the way they work, So they are prepared in a sort of automatic way to deal with whatever is digital, with social media. Although social media, I have my personal thoughts about that. It's a dangerous tool when it goes too far. But that's a good thing. They are already prepared into that. So, and we are advocating, of course, that we have been doing that for so many years, that even from the first year of medical school, there should be courses about the technology, about what we call today digital health. By the way, again, on the semantics, today digital health is the umbrella over what we used to be called telemedicine, e-health, m-health, u-health, and just name medical informatics, etc., etc. So let's agree on that. It's the overall umbrella for all this. And it should be as well in the medical schools as in the engineer schools, that especially in the engineer schools that are dedicating interest for health issues, to coordinate that, so that, because there are different ways of thinking. The youngsters that go for medical school, the youngsters that go for computers, but they need, again, to melt together in a way. And that's when, in the end, the digital health will prevail. I'm convinced. And by the way, I'm not a doctor. I'm even less a computer person. So for me, that's, as I say, old generation. When I was studying for economics and international or diplomatic sciences back in the 60s, we had, over the 4 years, we had 1 hour related to something that was called computers, okay? Just to tell you, but that's only 50, well, almost 60 years ago. But you see how it has evolved and how fast it is evolving. And there again, I would say, the subject is so vast, and that's a danger when it goes too fast to be able to control it properly. And certainly when we deal with technology, we are humans, and there are 8 billion people on the earth. And if you think that average, there are 3 generations in a century, 8 by 3, that's 24 billion people that turn around in 100 years, and that will be confronted with this. So we must make sure that it still remains human. It's great to be able to use technology, and technology is great, but we, the humans, must still master it. And in some cases, we do see that the technology gets over. And when we talk about artificial intelligence, Now, again, there is a whole discussion about what artificial intelligence actually means and how far it can or should go. But let's be aware of the possible danger. Now, I'm not against it. I'm just saying be careful, because if we let the technology, I won't go and sit in a car that drives itself to somewhere. Honestly, I won't. But I'm not saying it's not possible. And I've seen planes taking off and landing without the pilot intervening. A plane can take off and land alone. I've seen it personally, sitting in a cockpit of a wide body. But that's all good news. But again, we must be careful that we don't let it go too far, because we deal with humans. And if we can do that, and that's, you know, the sort of position we need to take through education. So educate properly. And within the international society, that's what we want to do. There are several companies that are specialized in accrediting courses, etc. We do even have a working group on accreditation and such. But one of the things that we also recently created was an endorsement from the international society, recognizing courses, you know, just that we give a sort of moral support to what is in the right direction, and of course under the responsibility of those who develop the courses, etc. Juliana, I want to really congratulate you. You are a model of what can be done among thousands of others in other fields. And therefore, this webinar is certainly and has been a major success. Also, congratulations to the organizer from the working group. And on the side also saying a great welcome to the maritime medicine team that is just wanted to join this team as well, because it fits together. I remember meeting with people. Actually, there are more islands on Earth than there are countries. And islands mean that you need that sort of digital health that is able to reach out to them. So very well welcome, and Lynn, I'm very pleased that you got back to us. We have known each other for many years. And well, that's it. Sorry if I took too long, but I think there were important points to mention.
Oh, thank you very much. It is it's always a pleasure to listen to you, Frank. I miss our time in Moscow and Luxembourg and so many other places that we met. So there are 2 or 3 more questions. I think that the next one is from El Lima.
Hey everyone, so I just wanted to share a few ideas from the point of view of a student. I'm Professor Herbert's student, and one of the things that I would like to say is that bioethical stuff is something that we do talk about every time we are planning in software. What I do believe that is an important thing, and I feel like it's important to mention here, is that whenever we see a client, we consider someone who has an idea a client, and whenever we're working with them, manage to create a bridge between the medical field and the technological field, we have some restrictions that we need to establish and respect. And one of these restrictions is the LGBT, which is using people's data and protect them. I mean, every time we have a project, we usually construct a project backlog and a vision of the project, which is we take this idea and then we structure everything we have to do with what we've been told by our clients. And what I think that we have to would like to mention here is that Professor Juliana is always teaching us how to use these technologies in a ways that is always ethical. So so we do not harm with this information, and all the tools we use, they're free, and I feel like I've been in the biological field before, but now I changed for the biomedical informatics. And what I would like to say is that the discussion that we do in our lessons, they're always valid. And when it comes to social policies, because we usually develop softwares and ideas for, what can I say? Make the world a better place. It feels like a little idyllic, but we all take that in consideration. So previously was mentioned that we have to be careful with the technology and how we can have it. But I can assure to everyone here that from a point of view of a student, we have received very, what can I say, ethical lessons from teacher Juliana. And everything that we do with the machinery and with the tools that we have, we're using for the best, this is from the point of view of a student, of course. That's it. It's just a commentary from a point of view of a student, who our lessons with teacher Juliana are usually at Fridays night, and even though it's during a night, we learn a lot because teacher Juliana, I'm really inclined to say because I'm a student, of course, but I feel like I can say, representing all the students from my major, that the learning techniques that teacher use to us are the best, and we are heading to a great start. That's it.
Thank you very much for your considerations. It's very good to see the point of view of a student, of course, the young generation, the ones that will be the future professionals in the area. So we have a time for 2 more questions. One, I think that now is Monica from Norway, from a very distant place in Norway. It's a remote area, and she was able to connect. I'm very happy to have you here, Monica. So if you have
I hope you hear me.
Yes.
Yes, that's quite nice. You see my background, it's a polar bear, but not so nearby, so I'm very happy. No, I'm here for a conference at the moment. Actually, my name is Monica Puskepler. Some of you will not know me. I was involved in telemedicine already in 2006-07 when I did my master's thesis. I'm a medical doctor. I did a master's thesis in public health. And I was very concerned about telemedical management on board ships. So I did this thesis in connection with oil platforms and not passenger vessels, just the normal seafarers vessels in the industry. And it was quite interesting to see how do they use in these early days telemedical advices at sea, TMAs. It was quite interesting, and since that time I'm quite involved, and just for the moment we and a group of other colleagues started a project, and I hoped Thais and myself, we can work together in a digital project on that. We intend to involve on expedition ships which should deal with passengers and researchers. It's called the Citizen Science Project, and on board a lot of different kind of projects will be involved from different kind of areas. So it could be a biological project, it could be a telemedical project, because we think, or myself, I really think telemedicine is quite a public issue. And it is very useful if you use it on vessels where passengers are involved. At the moment, it's not so on the big market in this ships industry. They do a little bit. This is a ship's doctor who use it sometimes, but it's depending on the ship owner's company what is allowed or not. And we want to involve people in projects or future projects where they can learn more about it and where we can test it. And the relation to space medicine is, of course, quite interesting because we have both together extreme environments. So I'm looking forward, maybe we can have a common project in the next year. It would be a great pleasure for me.
Thank you very much, Monica, for your words. And yeah, of course, we are designing the project together. I think that it is going to be a success.
Yes.
From spaceships to space missions.
Yes, exactly. That's the goal.
Okay,
Thanks.
so
That's all.
any more questions or comments? Oh, there are several congrats in the chat area from many different people that attended the meeting. Really enjoying the lecture, Juliana. So, well, if there is no other comment or question, let me check here. No.
Can I talk something?
Yes, sure, you can wrap up.
I was just going to comment some contributions. Of course, this I completely agree with this idea of the political view of digital health is really important, and it's something that, of course, it was not presented here during this lecture because it was more related to this idea of the technological and health professionals bridge. But of course, it's really important. I completely agree. And I'd like to mention that Larissa, that has asked the question, she's one of the students of Biomedical Informatics course, as we have other students here, like Natalie, and I saw that there are some others, Atus, and it's really important to listen to this kind of things. We know that, for example, Larissa is in the second year of the course, and when we see this kind of commitments of the students, of course, we understand, and going with the idea that Frank Livens just presented, that education is really important, and we're really happy to hear that. But that's it, just some comments. Thank you. Thanks so much, Thais.
Oh, my pleasure. So I think that's an hour and a half of a webinar. I think that it was a very successful one. Thank you very much for everybody to participate. And I wish, well, good weekend wherever you are. And I hope we can plan another one. We had one in May from this group with Professor Ganapati, this one in June from Professor Juliana, and hopefully one in July or August. I know that July and August are difficult months in Europe because of the summer vacation, but in any case, we are going to try our best to have a very interesting topic that everybody is going to leave the beach, leave the sofa, and and come to join us in a very, I hope, another successful webinar. So thank you very much to everybody, and I hope to see you next time, from wherever you are. Bye-bye.
Thank you. Thank you so much. Bye.
Bye.
Thank you. Bye.